welcome to our Vaccinate Clayton virtual town hall meeting. I am Amy Keeney, Deputy Administrator with the Board of Commissioners, Office of Communication. The purpose of this town hall meeting is to share information about COVID-19 vaccinations specifically related to Clayton County and answer questions for citizens, businesses, and employees. Additional information can be found at vaccinateclayton.claytoncountyga.gov. We have 5 panelists who will be addressing the COVID-19 at our town hall discussion today. I will ask the panelists to introduce themselves and we will begin the meeting.
Yes, good afternoon, everyone. I am Chairman Jeffrey E. Turner, Clayton County Board of Commissioners, and it's definitely a pleasure to be able to sit on this panel to talk about the coronavirus and the impact that it's had on our county and to correct some information. We want to make sure that we are putting out the most accurate and correct information for our citizens to be able to analyze it and then make a conscientious decision of their own to get vaccinated. Thank you.
Good afternoon. My name is Dietrich Stanford. I'm the Chief Operating Officer for the Clayton County Board of Commissioners. Again, looking forward to the discussion and providing some insight about Vaccinate Clayton.
Good afternoon. My name is Deputy Chief Zach Bach, and I serve as the Deputy Chief Medical Officer for Clayton County Fire and Emergency Services.
Good afternoon. My name is Jana McWilson. I'm the District Nursing and Clinical Director at Clayton County Health District, and I just want to thank you all for having me.
Good afternoon. I'm Dr. Sudo Reddy. I'm the Chief Medical Officer for Clayton County Fire and Emergency Services. Thank you so much for my participation in this panel, and I am also looking forward to the discussion and helping Vaccinate Clayton get more people vaccinated.
Thank you. Thank you so much. We'll step right into our first question. What is COVID-19?
Hi. COVID-19 is a disease caused by a virus called SARS-CoV-2. It is a respiratory illness, and we all know some have become seriously ill. They've required medical attention, including ventilator assistance. And then we all know that we've had people that have died from this virus.
How does the virus spread?
There are 3 main ways that COVID-19 is spread. The first one being breathing in the air when close to an infected person who is exhaling small droplets and particles that contain the virus. Number 2 is having these small droplets and particles that contain the virus land on your eyes, nose, or mouth, especially through splashes, which include coughing or a sneeze. And then when people touch their eyes, nose, or mouth with their hands, they have the virus on them. So these are ways that the COVID-19 virus is spread.
How can someone prevent from getting COVID-19?
Well, there are several ways. We want to make sure people get vaccinated and they stay up to date on their COVID-19 vaccine, including getting their booster shot. We want to make sure that they wear a mask. We want to make sure they're staying 6 feet away from others, social distancing. They want to avoid poorly ventilated spaces and crowds. We want to make sure people are getting tested to prevent spreading the virus to others. We want to make sure people are washing their hands often. And if you don't have soap and water, you can always use hand sanitizer. Making sure people are covering their coughs and sneezes, and cleaning and disinfecting areas where they inhabit. Making sure people are monitoring their health daily. So if somebody feels sick, making sure you're not going into work, because that's the way you can spread that to others. We also want to make sure people are following recommendations when they're put on quarantine or isolation precautions. And then taking precautions when you're traveling.
What are some of the recommendations for someone who has symptoms of COVID-19?
So for anybody who has symptoms, we want to make sure that they stay at home. If they're going out and going to be tested or going to seek medical care, we want to make sure that they're wearing a well-fitted mask. They also want to wear a well-fitted mask if they're going to be around people up to 10 days. We want to make sure that they're not traveling anywhere for 10 days. making sure that they're separating themselves from others, and again, monitoring their symptoms. Don't want them going out if they're knowingly sick and infecting others. Again, making sure they're covering their coughs and sneezes, washing their hands often, cleaning your surfaces at home, at work, surfaces that you may touch, and again, using that hand sanitizer when you're out. And avoid sharing any personal household items.
What should someone do if they have been in close contact with someone who has COVID-19?
If someone has been in close contact with someone with COVID-19, we want to make sure people who have been tested positive for COVID-19 within the past 90 days and recovered do not have to quarantine or get tested again as long as they do not develop any new symptoms. People who develop symptoms within 3 months of their first bout of COVID-19, they may need to be tested, depending on their symptoms and what's causing their symptoms. Now, people who have been in close contact with someone who has COVID-19 and they are up to date with their COVID vaccinations and their booster shot, they do not need to quarantine.
Why should my child get vaccinated against COVID-19?
So we want to make sure children 5 years and older are protected against COVID-19, so we want to make sure that they are vaccinated. When they get vaccinated, they're able to protect from spreading the virus to others. They're also able to protect from getting severely sick as well. While COVID-19 tends to be milder in children than it is in adults, it can make children very sick. It can cause children to become hospitalized. And then we've also had some children who have died. So getting that COVID-19 vaccine will help protect them.
If I'm pregnant or planning to become pregnant, can I get a COVID-19 vaccine?
Yes, COVID-19 vaccination is recommended for women who are pregnant, women who are breastfeeding, women who plan to become pregnant or might become pregnant in the future. Women can have a conversation with their healthcare provider. It is not required. So if a woman shows up at a vaccination site, they can get vaccinated.
Are COVID-19 vaccines safe, even though vaccines were developed very rapidly?
Yes, COVID-19 vaccines have been developed without compromising quality, safety, and their effectiveness.
How long does protection from COVID-19 vaccine last?
We still don't know exactly how long that protection lasts, but of course there is current data out that indicates most people do get a strong protection against serious illness and even hospitalization once they are vaccinated. There is increasing evidence that effectiveness of the COVID-19 vaccine protects us against mild symptoms, and those symptoms can wane over time. So in light of this, we all know CDC has advised that booster shots be given. And they want those given at least 5 to 6 months after somebody has completed their primary dose.
If I didn't get my second shot or the second dose COVID-19 vaccine within the recommended time, what should I do?
It is recommended that you receive your COVID-19 vaccine within that 3-week to 4-week period. But if you do not get vaccinated, if you wait a little after that time, it's fine. You will not need to repeat that vaccination series.
Should I get vaccinated if I've already had COVID-19? If I didn't get my second shot or second dose of COVID-19 vaccine with the recommended time, what should I do?
Yes, you should still get vaccinated because it's possible to get reinfected, and COVID-19 can cause severe medical complications. The CD recommends that people who have already had COVID-19 get a COVID-19 vaccine. With the vaccination coverage, you're better protected than you are with the natural immunity.
Are home test kits available?
Yes, at-home test kits for COVID-19 give rapid results, and they can be taken anywhere regardless of vaccination status or whether or not you have any symptoms. Home tests can be provided. You can order up to free at-home tests per household. You can go to covidtest.gov, or you can call 1-800-232-0233. You can buy at-home tests at your local pharmacies or retail stores. And then if you're not able to obtain an at-home test, you can visit community testing sites or contact your local public health department.
How does vaccination protect you and your community?
So vaccinations are going to be foundational in protecting the community and yourself. We've gone over my panel mate has gone over how it protects the individual, both children as well as adults. It's going to reduce your risk of hospitalization and death by almost 90%. And that includes protection through variants, through Delta as well as Omicron. That is one way it will protect you. It also reduces your chances of getting severe long COVID, also known as PASC, which is, as you know, things like COVID brain fog, neurological symptoms, and cardiac symptoms. It does a great job of protecting the community as a whole if we all get vaccinated. And this is by reducing transmission, and therefore we also protect those who are the most vulnerable, especially our seniors and those children who cannot get vaccinated yet.
Why is getting a high rate of vaccination important in Clayton County?
I'll answer this one. Currently within our community, we do have a high percentage of some of those comorbidities that would be considered high risk. Those would be including diabetes, obesity, hypertension, and then some of the other more frequent respiratory disorders such as COPD and CHF. So obviously the higher percentage we can get, the more effective it will be in keeping that population healthy and out of the hospital. From a fire and EMS standpoint, those are the things we obviously want to see to prevent the increased number of our community that is needing hospitalization. And currently right now, Clayton sits about 48% with fully vaccinated, whereas right now the state is at a total of 55%. So we would like to see our numbers come up, obviously, to meet or hopefully exceed what the state does as a whole with our total or fully vaccinated. And then obviously we'd like to increase the numbers who are getting their booster shots as well.
Thank you. Isn't COVID over? Why should I get vaccinated now?
So no, COVID is not over. Unfortunately, what we have seen over the last 2 years is that it comes and goes in waves, which is to be expected. We are still currently in that pandemic state. The natural progression of this disease we will move towards endemic, and that will be at the guidance of the CDC. As we transition to that phase of the pandemic into the endemic, you're gonna see where booster shots will become required more than likely annually to be something similar to what the flu shot is now. So because of that, we all need to understand that COVID is still a very deadly virus to those who are high risk and unvaccinated. And getting vaccinated does help decrease the chances of a severe bout with the illness, or hopefully prevents hospitalization.
Thank you. Will vaccinations against COVID become yearly?
Eventually, as the disease itself has not had any reduction in making people very ill if they're not vaccinated. If you are not fully vaccinated, your chances of severe illness, hospitalization is still extremely high. We are still in a pandemic. We are a ways away from it becoming yearly, and so having as many people, especially in our county, vaccinated as much as we can, as soon as we can, which includes right now. So as we move forward, yes, but realistically, that time frame is easily 1 year out, if not longer. So to make it so that we don't have more people becoming extremely hospitalized or dying, now is still very much the time to become vaccinated, get your second shot, or get your booster.
What is an mRNA vaccine, and what other types of vaccines are like this?
An mRNA vaccine, it stands for messenger RNA. We actually have messenger RNA all over our bodies. It's something that is fundamental to how our bodies work. What the technology that is being used for the COVID vaccine has actually been around for almost 20 years. It has not been able to be utilized prior to this because it requires very, very strict temperature control. These super cold freezers that you may have heard about. We here in the county have been able to get those freezers, and we have been able to manage what is called the cold chain so we can keep those vaccines viable. So the technology has been around for 2 decades. The mRNA vaccines require that cold chain to be secure and to maintain their ability to work in the body. The way they work in the body is that they mimic what's called a spike protein, which is very specific to COVID. And so it essentially allows the body to recognize COVID when you become infected, and your body is now ready to fight off COVID. And that's the best way your immune system can protect you from, as we said, severe illness, hospitalizations, death, and also those symptoms that we're reading about in terms of long COVID. In addition, I believe you asked if there was anything else like this mRNA vaccine. Currently, there is not, but there is an enormous amount of work being done to use this technology now that we've created the infrastructure within our country for everything from HIV to cancer. So you will be seeing a lot more of this in the coming years.
Thank you. Does vaccination protect against long COVID?
Yes. What we are seeing now, 2 years in, is that those who are vaccinated have less severe and oftentimes no symptoms of long COVID. Long COVID could be everything from skin symptoms like rash to things people call it brain fog, where you just can't think right. There's been sleep disorders recognized, and also as severe as heart problems. So it absolutely has been shown to protect against severe and even moderate symptoms of long COVID. Getting vaccinated, getting your booster shot has both short-term and significant long-term benefits.
People are getting COVID who are vaccinated. Does this really do anything?
Yes, as I mentioned in the prior question, it protects you from long COVID. However, if you are vaccinated, your chances of having mild symptoms and not having long COVID are in the 90%. If you are not vaccinated, your chances of being in the hospital, having severe and long-term consequences, or dying are extremely, extremely elevated. A 90% protection rate from getting both shots, as well as a booster when recommended, those are good numbers, and they protect you significantly. So even if you get COVID, your symptoms are going to be very mild because your body has recognized it and will be able to protect you from the more significant symptoms.
How can you protect employees from the COVID-19?
So primarily, our panelists have kind of really emphasized a lot of the things that we can do, talking about from an individual and a community standpoint. But those respective policies and those recommendations can be utilized with our employee base as well. So that would include reminding our employees that people may be able to spread COVID-19 even if they don't show symptoms. Consider all close interactions within 6 feet with employees, clients, and others as potential sources of exposure, discouraging handshaking, hugs, and fist bumps. I know we love to do that, but we really discourage that in our present environment. And then lastly, encourage the use of outdoor seating areas and social distancing for small group activities such as lunches, breaks, and meetings. Our Board of Commissioners have been very vigilant as it pertains to providing resources, whether it's masks, whether it's hand sanitizer, or even figuring out ways for which we get information out to our employees, even from teleworking. So from an employee standpoint, from Clayton County standpoint, continue to do those things that are recommended by our health professionals, and of course the policies that have been pushed forth by the Clayton County Board of Commissioners.
Thank you. What is Clayton County doing to make sure the public is safe?
Yes, the Clayton County Board of Commissioners has made it very clear that the protection and welfare of our citizens and employees is first and foremost, priority number one. We've been blessed in this county to receive a lot of money from the federal government for PPE as well as for vaccinations and other resources that we can place or put into our community. And we've been doing that. We've had a lot of money spent towards home kits for our citizens and had home kit giveaways as well as vaccination drives throughout the county. We're going to continue to do so. But we also have to do more in terms of partnering with our 501c organizations as well as our faith-based community to get the word out, to get the correct information out. Information is power, and a lot of people in our community are hesitant to get vaccinated simply because they're getting the wrong information. That's why the opportunity to sit on this panel is very important to get out the correct information. Everybody should be able to get the right information, make decisions based on that information, and then hopefully not only keep it to themselves but tell others. We have seen too many situations where people are just assuming that they don't have to take the shot because the virus, not the virus, but the vaccination really doesn't help. If you go to any hospital, or if you've seen anybody or know anybody who's ever had COVID, the way they fight for their life, the way they fight for a breath, there's no doubt in my mind that they would be running to a vaccination site to get vaccinated because the vaccinations, it helps. I'm fully vaccinated myself, had the booster, and I guarantee you if they give me another one, I'll take that too. But it's very important that we listen to the information, follow the science, and then trust the process.
Will the county be hosting another home test kit distribution event?
Absolutely. We're in the middle of trying to put something together now. I just had a conversation with an organization this morning, as a matter of fact, who's just biting at the bit to do more in our community. And I am very thankful that the doctor, and I can't think of her name, and I apologize because I know she's tuning in, gave me a call this morning to talk about doing that very thing, and we will partner with them to make sure that we provide as much opportunity in our community to take the excuse out of any citizen to say, well, I couldn't get to north side, east side, or whatever within the county, because we can come to you. This organization even come to your house. So it's not only that, but the fire department, the EMS, they're doing a great job in making sure that through our mobile lab, that they're going into these hardest hit areas where we also are seeing the highest hesitancy rates to be able to provide shots to that sector of the community as well. So again, we're trying to take out any excuse for somebody who wants to be vaccinated to get vaccinated.
So since there will be additional distribution kits given out, will there be more than 2 tests given per household?
That just depends on how many we get. We do have a number on hand, and one of the EMS or Dr. Suda already can maybe tell us more about that. But if we have to, and I'm sure we will have to purchase more, but we stand ready to do that. Again, we have received a lot of money from the federal government that allows us and helps us to be able to purchase additional.
Thank you. Will the public ever be required to be vaccinated to enter county facilities?
At this time and point, no. But we do have a mask mandate, and we expect our citizenry to follow those guidelines. It's not only for their protection, but the protection of our employees. We got to have a workforce that's healthy to be able to provide the excellent services that they are providing today. So for us to be able to continue to do that, we have to have not only our citizens' health in mind, but especially our employees so they can continue to do what they do.
In the future, will county employees be required to be vaccinated?
Not at this time.
Amy, if I could expound upon that, I think the other thing we want our public to recognize that Clayton County is very uniquely positioned. We're one of the few communities in the state of Georgia, even the country, that has a medical director under the county's operation with Dr. Reddy and then Chief Botkins in that group. And so we try to follow the science. They do a phenomenal job in listening to the community and figuring out what the science is telling us. And then in turn, they take that information and make recommendations to the Board of Commissioners about policy decisions. So the chairman is 100% correct. As of right now, the decision has not been made to have employees vaccinated or required to be vaccinated, but we certainly listen to the science that's given to us because we have expertise readily available to Clayton County, and that has served us well in making, wise decisions about where we land with vaccinating our community.
Thank you so much for all your responses. In closing, we'd like to thank our panelists who have all participated in our Clayton County Board of Commissioners Vaccinate Town Hall meeting. At this time, I would like to ask the panelists if they have any final comments before we conclude.
Okay, well, I'll start then. First of all, I appreciated our Department of Communications and all of our panelists for being on this panel to talk about COVID-19 and where we are going in the future. But first of all, let me say this. We are still in the middle of a pandemic. Although the numbers are going down, don't be disillusioned. The threat is still there. This virus is still making people very sick, and people are still dying from it. So please, again, if you can hear this, and even if you're not on this line, those of you who are, please share this information. Encourage your family members, your friends and neighbors to get vaccinated. The best way that we can mitigate this is to get vaccinated and to do what is expected of us as we follow the CDC guidelines. I can't say it enough. When you're vaccinated, you're protecting your parents, your grandparents, even your children. But at the end of the day, who knows, that life you may be saving may be your own. Thank you.
These questions and others have been submitted will be shared in our frequently asked questions section on the vaccinateclayton.claytoncountyga.gov webpage. Please check back for updates as information will be submitted often. Stay healthy, mask up, and vaccinate Clayton. Thank you.
Thank you.